Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to Direct Connection. Tonight, a new executive order from Governor Hogan is closing all bars, restaurants, movie theaters, and gyms in the state. This as officials continue rolling out orders to keep people from congregating and spreading the coronavirus.
We have never faced anything like this before. This is going to be much harder, take much longer, and be much worse than almost anyone is currently understanding. And unfortunately, far too many people have continued to ignore those warnings and are crowding into bars and restaurants, willingly putting the health and safety of others in grave danger. Decision makers at the federal, state, and local level are going to have to take drastic actions right now that may seem scary, they may sound extreme, they will be terribly disruptive, but they are also absolutely necessary to save the lives of hundreds of thousands of Americans. Every single one of us needs to take serious actions to immediately limit day-to-day interactions and activities.
That was Governor Hogan this afternoon, Monday afternoon. Tonight, Direct Connection will connect you with the co-chair of the University of Maryland Medical Center's COVID-19 Incident Response Team, Dr. Greg Schrank. He is an epidemiologist and assistant professor of medicine at the University of Maryland School of Medicine. Doctor, I know you're busy. Thank you for being with us.
Thanks so much for having me tonight.
I'm sure people out there have heard all sorts of good information, maybe some not so good information. Let's start with the basics on this. What should everybody know about this coronavirus?
So the coronavirus, COVID-19, as the disease that it causes is known as, is a type of a virus that typically causes the common cold. That circulates around the world and around the communities here in Maryland every year. I guarantee that you and I have both experienced a respiratory infection with coronaviruses before, as many of our viewers have. What's different about this virus is that it's brand new. It's never been seen before on this planet. It's never infected a human being before, and so none of us have immunity, meaning we haven't had the opportunity to develop antibodies that can protect us from this virus should we come into contact with it. And as a result, we can see that it causes, especially in those who are more vulnerable, some severe respiratory disease that is a much greater degree of severity than the common cold typically does.
It seems like the official response, a political response to this had been maybe a week ago. There was a variety of people downplaying it, some people more concerned, but it's maybe coalesced around a very strong message, which we just heard from the governor, and beginning to take measures to really limit people's ability to move around, go places, and interact. Is that all warranted?
So I think what's most important to acknowledge here is that we are seeing from other locations around the world, in particular recently Italy and before that in China, that this virus does have the potential to cause severe disease among many individuals. That being said, about 80% of people will have very mild illness. And what the governor is doing, and we're in alignment with the governor in our efforts at the medical center, is an attempt to reduce the number of cases across the state as much as possible, so that way we can protect those people who are much more vulnerable. Because this virus is new, because many of us are susceptible to it, it's possible that there can be many, many people simultaneously infected if it were to spread throughout the community, and that has potential to overwhelm the healthcare system as well, which is also a really important component to this response, is attempting to minimize its impact on hospitals and primary care providers.
Let me remind our viewers, if you have a question about the coronavirus, how you should deal with it, give us a call. We'll have the number up on the screen. You can also email your questions. Email address is livequestions@mpt.org. That brings us to this idea of flattening the curve. And we have a graphical representation, and I've seen these in different forms, but the idea is that projections are this is going to spike, this is going to go parabolic and exceed the dotted line on the screen, which is the capacity of the healthcare system, the idea that it could be overwhelmed, as you say, and explain the second bump there is what you're hoping to have, not the first one.
Right, exactly. So unlike certain other types of infections like strep infections, staph infections that we can treat with antibiotics, this virus has no medical therapy that we've developed for it yet. And unlike influenza, to which we have a vaccine, there is no vaccine as of yet for coronavirus either. And so what we really have in our toolbox to try to fight this infection is are different measures that we can take to limit transmission throughout the community. And that's really the idea, as we saw in that curve, of trying to limit the total number of cases. And that has two substantial effects. Is one, it can help to protect, as I mentioned, the more vulnerable persons in our communities, but then also help to limit the surge of patients that we may otherwise see into our hospitals and healthcare settings, which would be quite overwhelming.
Email question from a viewer, parent, little kids who are home from school. Is it okay to allow my kids to play outside with other kids in the neighborhood, groups of 2 or 3? What's your opinion about doing one-on-one play dates inside a person's home? Is that safe? Or is there a difference between outdoors and indoors?
Yeah, that's a great question. I actually, this is a question myself and my wife have spoken about. We have a 22-month-old at home, and we've had discussions about whether or not play dates are in her future. So I would say that, so this brings up the good concept, or it's a good introduction to the concept of social distancing, meaning that this virus is transmitted from person to person through small droplets, which are produced by our breathing tract, our respiratory tract, when we cough or sneeze, and sometimes even just through touch. If we were to touch our faces and some of our saliva or mucus ends up on our fingers, on our arms, we touch surfaces, we touch other people, that's a mechanism for transmitting this virus from person to person. So whether it's an adult or it's a child, close contact with others is the primary route by which this is transmitted. So as much as can be done to limit close contact, no matter how difficult or inconvenient or stressful that may be, that's really what this effort is about in social distancing.
Okay, I would like to social distance by wearing a mask in public, but I don't see, I've seen a handful of people doing that. And I know it's complicated because of the issue of a potential shortage of masks for healthcare professionals. But if you were riding a crowded subway somewhere, aren't you better off if you've got the appropriate, properly fitted mask on?
So I should say that the purpose of those masks is really to, as you already mentioned, protect healthcare workers that have prolonged direct close contact with potentially infected or infected patients. The other use for masks is if we do know that somebody's infected and they're coughing and sneezing, it can help to limit the spread of those droplets that I mentioned from entering the surrounding air and getting onto surfaces around them. Outside of that, it may not be entirely effective at preventing somebody from coming into contact with the virus because, as I said, we can touch surfaces and the virus can be living on those surfaces. We can then go on to touch our faces, our eyes, our mucous membranes. And so that's why, in addition to the recommendations around frequent hand washing and using alcohol-based hand sanitizers, you'll see the CDC talking about trying to avoid touching your face as much as possible, which which is really challenging, but a key component to this. And I would just also then refer anybody who's watching to the CDC's website, which has a lot of very practical information that people can read about to understand how they can best protect themselves and their family members.
You're helping to lead the response team at a very big city teaching hospital. I heard from somebody I know who works at a smaller community hospital that they, as of Monday, are starting to see an uptick in people coming into the emergency room, having been referred there by their primary care physicians or an urgent care place because they're exhibiting the symptoms. And we should talk about what those are. But generally, they're not being admitted at this point. They're not seeing a big wave of admissions, although they strongly believe it's coming. Do you share that, and how do you prepare for it?
So I'm glad you brought up the symptoms. This is a good opportunity to speak to that. Primarily, they are symptoms of a respiratory infection, as many of us have had experienced before. Very often fever, although not always. Coughing, sometimes some difficulty breathing if it's more severe. I think what's most important is that people that are experiencing severe symptoms that are not responding to fever-lowering medications or pain relievers, that are experiencing difficulty breathing, or that are just getting worse over time, those are the people that really should be going and utilizing our emergency departments. Everyone else who's experiencing symptoms, I really encourage them to reach out to their local primary care providers for some recommendations. But what we're really asking people to do is avoid the emergency departments at all possible if you're not experiencing an emergency.
And trouble breathing, blue fingernails is an emergency.
Oh, absolutely. If it's an emergency, I would please call 911. We really need to get medical assistance to you as soon as possible. Come into the emergency department if you're not feeling well and symptoms aren't getting better. But I ask that your first call be their primary care provider.
Let's go to the phones. Montgomery County, this is Martha. Martha, thank you for calling. Go ahead.
Hi. I'm wondering, what is it that ends this virus, that makes it peak and go into the declining number? Does the virus mutate, or do a certain number of people have to get it?
Martha, glad you called. We'll get you an answer. Thank you very much.
Thank you.
Yeah, thanks, Martha. That's a great question. So there are multiple ways in which this virus may start to wane from transmission in the community or decrease in numbers. One of which is that there may be a component to what we call seasonality, meaning that typical circulating colds and viruses, in the summer, we tend to see them less and less, and they're less effective at being transmitted from person to person, as we also spend less time indoors in small contained spaces around each other more frequently, and we're out in the fresh environment and in the sunlight. That can help as well prevent transmission. Because we're just not around each other quite as much. The other thing that will be effective, as you said, is as immunity or antibody responses built up among people that are infected, the likelihood of them getting reinfected immediately is substantially lower, and so that can also help to prevent further spread. We also hope that our scientific community around the world is working furiously hard to develop a vaccine as soon as possible to this virus, which then would also be, of course, effective at preventing infection.
I keep hoping that one morning we're going to wake up and the news is going to be that a group of doctors somewhere, maybe downtown Baltimore, has figured out that if we combine this medicine with this antiviral, we got it. In the armament of treatments you have, nothing's really clicking yet.
Well, I think every day we learn more and more about the virus, and our colleagues abroad in other countries have already been doing an incredible amount of work to study different possible medications or therapies, and we're learning from their experiences, and we'll be learning ourselves as we go through this. As of yet, our primary therapies for those 80% of mild cases, or 80% of cases that are mild, are just really resting up, staying hydrated, avoiding contact with others, especially those who are more vulnerable, and staying home from work. But for the more severe cases, it's really monitoring in the hospital, supplying them with additional oxygen as needed, and helping them to recover from the virus.
How long after somebody gets these symptoms, maybe they don't even need to go to the doctor, it's that mild, how long do you self-quarantine yourself?
Yeah, that's a great question, and we're looking to our public health authorities for guidance on that, and both at the city, state, and federal level. Generally, along with other viruses, once a person has, once their symptoms have resolved, they're no longer having fevers, they're no longer coughing or sneezing, the likelihood that they are contagious or effective at transmitting the virus decreases substantially. So it's really based on a person's clinical symptoms that we go by, in addition to what we understand are the sort of typical lengths of time that people recover from these viruses.
Let's go back to the phones. Fairfax County, this is Jennifer. Jennifer, thanks for the call. Go ahead.
Oh, hi, I'm Jennifer. How you doing?
Glad you called, Jennifer. What's your question?
My question is, what about our mail that we receive daily? Nobody talks about it.
You're concerned that there would be germs on it, basically.
Yes, I am, and because I have family in France, and I just don't want to receive their mail because the coronavirus can be on there.
Thanks for the phone call, and I don't want to mock that at all, because what I've been doing is like, small change. You wind up, and I'm actually trying not to use cash, using credit cards more, but if I have, some dollar bills, I'm setting them aside for a day or two to sit there. I mean, is that really stupid, or could there be some virus particles there?
So that's a great question, and none of these are certainly are stupid at all. We do know that the virus has the possibility or has potential to live on surfaces for fairly long periods of time, hours and even up to days. Not just this particular virus, but coronaviruses in general. And this is where I think that following the guidance of our CDC colleagues who are recommending frequent hand washing, 20 seconds under warm water with soap, or using alcohol-based hand sanitizer, cleansing down surfaces after we've been touching them. Those are the efforts that we can really focus on to improve or to reduce the risk that we'll become infected, rather than avoiding touching our mail, avoiding touching money. I mean, we still do need to function and continue to live our lives, and so really just focusing on all of the things that we can do, like hand hygiene, is what's most important.
Here's an email question about travel. My father-in-law has a flight tomorrow from Maryland to Arizona. Is it safe to fly? What about any advice you have somebody who is soon, for somebody who's soon to board an airplane? Is there a way to protect yourself there?
Yeah, and I think that's exactly what we were just discussing, is just being careful, being aware of your surroundings, wiping down surfaces and washing your hands. Air travel, in particular, any transportation hub, there are a lot of people that you're around that you may come in contact with as you're waiting in airport lines, as you're boarding the airplane and sitting on the plane itself. Social distancing, really, one mainstay of that is maintaining about a 6-foot distance from another person in case they were to cough.
Not on any airplane I've ever been on.
Exactly, yeah.
Or the part of it
not
that
the coach, yeah, not the coach that I'm used to. Exactly. So, in order to really reduce the risk as much as possible, and I think we've seen this in some of our recent recommendations from the CDC, is, if possible, avoiding air travel, particularly if you're an older person or at more risk for serious health adverse events from this virus.
Why is this thing, I guess the flu targets the elderly. A lot of older people are more vulnerable to it. Is this different from that in some way?
Well, they're both respiratory viruses. They both cause some similar symptoms with fever and cough and sometimes difficulty breathing. In general, as we age, our antibodies and our immune cells become a little bit less effective at fighting off infections. And so, similar to the flu, this coronavirus, COVID-19, does seem to, and especially persons over the age of 70, cause some more severe disease. And so while it's these measures that we're seeing taken by the governor and by our other leaders across the country are certainly inconvenient and difficult and challenging for many people, they're also aimed at protecting those persons who are at greatest risk.
Let me run through some email questions. Are pregnant women more susceptible to the novel coronavirus?
That's a great question. There's not quite as much information that we have at this time about women who are pregnant that may come into contact with the virus. We do know that in general, like older persons, the immune system of pregnant women is a little bit dampened in comparison to non-pregnant persons, and so just like older individuals, we're really aiming to protect our pregnant women as well with all of these interventions.
Let me read through this. It's a question about testing, which we should talk about. Question is, when tested positive and asked to stay home for 2 weeks, how do you get cured? 2 people from Montgomery County were tested, and now they say they are cleared to staying away from people. Does that cure you? So it was time, barring any complications, and you get better, and ultimately you can go back into the world.
Yeah, so it really is time. As I mentioned, there's no medication that we know that's effective at curing this virus just as of yet. So what I would say is that for about 80% of people that get this virus, they'll just feel like they have a bad cold, and they'll want to stay at home and lay out on the couch, and I would encourage them to stay hydrated, rest up, catch a few of their favorite TV shows that they've been missing out on, but really carefully monitor their symptoms, because it is possible that it could progress to something more severe. And so it's during that period of time, if you're noticing that you're not getting better on your own after a few days or into a couple of weeks, that you should definitely reach out to your primary care provider to see if you need further evaluation. Any
like home medications to avoid? People think of Tylenol or Motrin, Advil, maybe a cough suppressant. Is that a good idea?
Definitely medications that reduce fever or can treat some discomfort. Pain-relieving medications can be a great help at trying to get over this. And so I would certainly encourage people to use those. And they can consult with their own primary care provider about any other medications that might be helpful. But hydration, eating well, and resting up to recover.
Here's an interesting question. What are the false positive and false negative rates for the coronavirus test?
Yeah.
There's multiple tests, so there may be multiple answers.
That is a very good question, and I think that's also something we're continuing to learn about more and more every day, especially as testing capacity or the ability to perform tests expands across the country in different settings. We know that there are state tests available through our state health department as well as through commercial labs. It does seem as though if the virus is present, certainly, and it's a result that is positive, that's indicative or means that you clearly have the infection. Although there may be some people, especially early on in the disease course, or maybe very late in the disease course, where there might not just be enough virus shedding from your mucous membranes to detect it.
Let's take a call from Anne Arundel County. This is George. George, thanks for calling. Go ahead.
Thank you. I'm wondering if the doctor has any perspective and opinion on, since we obviously were caught flat-footed here, particularly with the testing, if this is a result of a long-term strategic decision by the current administration to reduce spending on medical research, or whether it was more of a tactical decision on trying to minimize the political backlash if there were.
George, yeah, appreciate the question. As always, not sure we're going to have a definitive answer for you, but your thoughts?
Yeah, certainly. I'm not currently employed in any administrative capacity within the federal government to be able to comment on that by any means. What I can say is that within the state of Maryland, within certainly in Baltimore City where I'm working, but then throughout the state, we are really working fast and furiously to increase our testing capacity and get tests available to those persons who need it. Right now, we're focusing and prioritizing on especially healthcare workers that may be feeling unwell, or those who are most severely ill requiring hospitalization, though I think we'll continue to see our testing capacity expand over the next week to 2 weeks.
So we may have been a little bit slow out of the off the blocks, out of the gate. But at this point, it sounds like it's all hands on deck. Can we learn anything from other countries? Are there some places, maybe South Korea, talked about Singapore before the show, that are doing it right? What can we learn from them?
Yeah, I think so. There's really two components to a response, something called containment and something called mitigation. And containment is what we have seen effectively done in many places around the world, of identifying cases early, trying to track persons that they may have come into close contact with, isolating them. Once the virus is out in the community, and we have seen some evidence of community transmission here in Maryland, we're really in the mitigation phase. And I do think that we've seen effective use of social distancing in other countries, and with closure of mass events, that really can help prevent the spread of this virus to many large groups of people that are gathered together.
You mentioned earlier the CDC website, plenty of other good places to go. University of Maryland Medical System.org/coronavirus has good information, and I think everybody's paying attention.
Yeah, I would encourage you, anybody that's listening, to check out those websites. There's a lot of great information there.
Doctor, thank you, sir. We have to leave it there. Thank you for joining us for Direct Connection, and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.